Welcome to the stage, Co-Chair Mike Harnish.
Hi, I'm Mike Harnish. I'm 12 years old, and I have CF. Cystic fibrosis is a genetic disease that affects both your lungs and your digestive system. 30,000 people in America have CF. As for your digestive system, you can't digest your food. You must take special medicine each and every time you want to eat. Also, most of the people with CF can't even maintain a healthy weight. We must be put on weight-gaining supplements. Our lungs get clogged with a thick, sticky mucus. Once the disease progresses enough, this mucus will get so thick that I won't be able to breathe, and my only chance of survival will be a lung transplant. Cystic fibrosis is progressive.
Good evening, everyone. My name is Mike Harnish, and that was me 20 years ago. It's hard to express just how different CF community events were back then, but I would say we were cautiously optimistic. New, never-before-seen treatments were being talked about. These so-called protein modulators were still just ideas on whiteboards. Nobody knew if they were even possible, let alone just how well they would work. But they represented hope. They were something we could move toward, and a reason to keep going. Today, I hope you feel that same optimism that I felt 20 years ago as we look at current research being done in the CF community and recognizing that the ideas we share today are the transformative treatments of tomorrow.
Thanks, Mike. Growing up with CF, as optimistic as I was, I never dreamed I'd see my own 50th birthday. Yet now, I have seen that and more, and I'm seeing real hope turn into reality. As the life expectancy for someone with CF consistently exceeds my own age and beyond, and the life I live, filled with transplants and hospital stays, is more an exception, the treatments improving the quality of life for so many with CF is encouraging, and why I push for more treatments, research, and understanding of the disease and post-transplant care, and a cure for all of us.
Welcome to ResearchCon 2025. Like I said, I am Mike Harnish. I'm a rare disease advocate, a genetics researcher, and a CF patient. I'm thrilled to be here with you to discuss the exciting updates on research and care in cystic fibrosis today. Before we dive into our keynote, I did want to share a few reminders for everyone. If you experience any technological problems throughout the day, please visit the help desk in the Expo booth link. We also want to remind everybody of our event conduct guide. Please be kind, open-minded, and respectful of everyone's opinions and life experiences. Please do not ask or give medical advice. If you need staff support at any time or need to report a violation of these guidelines, we encourage you to do so at that help desk link. Our presenters will be answering questions in the chat during their presentations tonight. While they won't be able to answer questions about individual diagnoses or treatment plans, we encourage you to use the information that you learned today to have conversations with your care team. I'd now like to introduce you to my co-chairs, Jen Weber and Melissa Putman.
Hi, everyone. My name is Jen Weber, and I'm an adult with CF who has been fortunate to receive 3 double lung transplants within the last 15 years. I'm an attorney and musician, and I'm excited about this year's ResearchCon event for a couple of reasons. Mainly because I get to learn firsthand about post-lung transplant research and also hear from people like me who are involved in CF clinical trials and research. And now I'd like to turn it over to Melissa Putman.
Thanks, Jen. My name is Melissa Putman, and I am an adult and pediatric endocrinologist at Massachusetts General Hospital in Boston. I take care of people with CF in the adult CF program at MGH, and I also lead clinical research studies focusing on the endocrine complications of CF, including CF-related diabetes, and bone disease. And I am so excited about this year's event. In planning this conference, we really wanted to highlight some of the big topics of interest to the CF community, particularly some of the non-pulmonary aspects of CF. We also want to spread the word about exciting research studies that are going on right now that you can be a part of to shape the future of CF care.
Hi again, everyone. I, like my co-chairs, am very excited about this year's event. We are fortunate enough to have some of CF's top researchers and clinicians here with us tonight. As therapies have progressed, so have the expectations for those of us living with CF. And I think you'll see that reflected tonight as we focus on some areas of interest to the community, such as mental health, choosing between modulator therapies, and most excitingly, what it's like to actually age with cystic fibrosis. I'd like to take a brief moment before we begin. I'm sure that many of you have questions about how the current policy landscape is impacting cystic fibrosis and CF research. I'm pleased to say that we do have David Elin here today. He's the Senior Director of Advocacy and Government Affairs for the Cystic Fibrosis Foundation, and he'll be speaking briefly about what the CF Foundation is doing to support initiatives for CF research and development through policy and advocacy.
Well, great. Thank you, Mike and Melissa and Jennifer, for having me. It's truly an honor to speak to so many of you today who are here to talk about the value of research and all this exciting stuff that's happening in our community. And I want to make sure that we give you a little bit of a look in what's happening here in Washington as it impacts the CF community. So I think it goes without saying that, and this is a fairly neutral view, the temperature in Washington, D.C. is hot right now. And there is a lot going on and in the policy space. And I want to just take a moment to let everybody know and to remind you that the CF Foundation is not about the politics in Washington. We are about people. And more importantly, we are about people with CF. And policy and advocacy is part and parcel to our mission because we want to make sure people have access to life-saving treatments and care as they go through their lives with CF. That said, our policy agenda is fairly stout. We are working on preserving Medicaid, defending public health agencies, preserving patient protections in the Affordable Care Act, addressing modulator access, advancing policies to combat antimicrobial resistance, making sure people have access to telehealth. But the current environment right now and where Congress and the administration are, we have two key priorities that we are hyper-focused on. One is protecting Medicaid. And the reason that I want to share why this is so important, and many of you know this, but just as it relates to our community, Medicaid is a vital source of coverage to half of kids and a third of adults. Nearly 40% of people with CF across the country rely on Medicaid for inpatient, outpatient care, medications, treatments, all needed to live a healthy life. Many of you know this. And the CF Foundation vehemently opposes broad structural changes to the Medicaid program that could impact patient access to crucial care and treatments. And as you know, because CF is a progressive disease, patients who rely or who delay or forgo treatment may face increased risk of lung exacerbations, lung damage, costly hospitalizations, and more. So Medicaid is just a critical program for our community. And currently, the proposal in the House of Representatives right now is to cut the Medicaid program by up to $880 billion. So they're looking to save $880 billion from Medicaid. And there's three kind of ways in which they're looking to do this. One is kind of reduced funding, sort of altering Medicaid's formula to restrict funding to states. Another one is to roll back Medicaid expansion, which would mean losses in coverage for people who benefit from Medicaid expansion in the states that have taken advantage of that opportunity. And then the other is implementing what's called a work reporting requirement. So efforts to make eligibility contingent upon a work or looking for work and things like that. And these are things that we just know are not going to improve the program. In fact, they're going to result in a loss of coverage and loss of access to care. And we know that that's just not acceptable for our community, for the 40% of people that rely on Medicaid across the country. So we have been working diligently, both here in Washington and out in the states, to rally our community, to call Congress, to let them know that how important Medicaid is to our community, how important it is to you if you rely on Medicaid as a source of primary coverage, or maybe it's a secondary source of coverage for you. It also is a vital source of reimbursement for our care centers and our care teams. Hospitals rely on Medicaid reimbursement to fund their programs, to keep the lights on, so to speak, in the hospitals. So Medicaid is just a vital source for our community. We want you, when you have the opportunity, call Congress, tell them how important this program is to you. It is a lifeline for people with CF, full stop. And any changes to Medicaid, any cuts to Medicaid will result in loss of coverage and potentially hurt people with CF. And that's just not acceptable to the CF Foundation. The other thing that we are hyper focused on, and I think this very much relates to your conference, is protecting our public health and science agencies. And right now we are focused on the NIH and the FDA, the National Institutes of Health and the Food and Drug Administration. The CF Foundation is dedicated to protecting CF research, as you know, which is vital to ensuring that people with CF have the opportunity to live long, fulfilling lives. And look, the CF story of transformation and progress just simply does not exist without the NIH. The NIH funds that basic early stage research, that basic science that is the foundation, the bedrock of the research and of the advancement in treatments that we have today. And moving forward, to get to that, to make sure that everybody with CF has access to a life-saving treatment and eventually a cure, we need a well-resourced, well-funded National Institutes of Health. And we need that vital bedrock research infrastructure to exist in a healthy way so that we can get to the treatments we just don't know that don't exist today. The second piece is the FDA, the Food and Drug Administration. That's the agency that approves and partners with patients and companies to bring these vital treatments to the shelves, to make sure that patients have access to them. And we simply can't pursue our mission and find a cure and make sure that everybody has access to a life-saving treatment without these two agencies. So right now, what we're asking folks to do, and what you can do, is you can call your members of Congress and tell them to protect these vital agencies. Congress has been supporting these two agencies annually for decades. Largely has been a bipartisan and not a political issue. And today, as we see in the news, there are cuts happening in both of these agencies, whether it's due to a reduction in force. You might see the acronym RIF, whether it's through the reductions in force, which means less staff, less resources for people to do the work. And quite simply, if there's less people, there's less opportunity to advance these treatments and to get them onto the shelves for our loved ones with CF to access. So look, the temperature's hot, but what we know is true is that without these agencies, without programs like Medicaid, we simply wouldn't be where we are today. And we won't be where we need to get to tomorrow if these are not well-resourced and well-funded programs. So please join us in calling on Congress to protect these vital programs and agencies It is their responsibility to do so. They've been doing it for decades. That's why we are where we are. And we're not alone. There's other groups, there's other organizations that are also in full agreement with us on this, and we need Congress to stand up and fight for us. So with that, I know there's some links in the chat that you can take advantage of and use our resources to call your members of Congress, but please join us in this fight. We're in it with you until it's done, and I'm excited to see where this conference goes. So with that, I'm going to turn it back over to Melissa. Thank you so much for the opportunity to talk to you today, and have a wonderful conference.
Thank you so much, David, for these comments. We really appreciate your sharing what the CF Foundation is doing and also how everyone here can make a difference. And one way to get involved is learning about and participating in research. And we have a lot of great information to share of what's to come from each session tonight. I'd like to turn it back to Jen, who is going to share a subject she's very familiar with, life post-lung transplant.
Thank you. The post-lung transplant update session is an interactive 70-minute session with 50 minutes of presentation and 20 minutes of audience questions, and includes two top experts in transplant care, Dr. Alexander Graham and Dr. Grant Turner, who will focus their discussion on post-lung transplant research. This will include research efforts and future plans, fundamentals of CLAD, which is chronic lung allograft dysfunction, and treatment options, and an update on the CFF Lung Transplant Consortium biorepository and registry. An adult with CF and post-transplant recipient, Elle Kellner, will discuss her personal input on her experiences managing CLAD throughout the session.
And then concurrent with the post-lung transplant session will be the GI and metabolism session. So this session brings in two of the top experts in gastrointestinal disease and nutrition in CF together to talk about how these fields are changing in the post-modulator era. GI symptoms, colon and pancreatic cancer, weight gain, obesity, these are all becoming greater clinical concerns, especially for the aging CF population. Hear from a person with CF, from Dr. Steve Friedman, a gastroenterologist, and Dr. Jessica Alvarez, a nutritionist, who will tell you about what we know about these issues and what research is being done to find out more.
We also have a session on genetic therapies. So if you've ever been interested in genetic therapy trials, either participating in them or just knowing how they work, this should be an interesting talk for you. Like most of our talks, we're going to go through what genetic therapies are and what the process is like, on paper at least. Unlike previous talks we've given on this subject, we're going to focus more on real-world experience. We have a research coordinator, a principal investigator, and a patient who are going to have a roundtable discussion about what the process really looks like once you're out in the real world.
Our 50-minute session focused on mental health will include a 20-minute Q&A. You'll hear from experts in the field, Dr. C.J. Bathgate and Dr. David Fidel, about what we know and don't know yet about the impact of CFTR modulators on mental health, as well as upcoming research in this area. We'll also hear from Jeremy Lane, a parent of 2 children with cystic fibrosis, as he shares their mental health experiences and the questions he had along the way. Bring your questions, as they will end with a 20-minute Q&A.
And I am so excited about this session, the Clinical Trials Roundtable. Researchers from 4 multi-center clinical studies investigating topics in CF-related diabetes, in nutrition, and colon cancer screening will tell you about the studies they're leading, the questions they're hoping to answer, and how you can get involved. This session will include a short presentation by each speaker, but the bulk of the time will be spent in a roundtable discussion and Q&A.
Our next 20-minute session will be a 20-minute presentation followed by a 30-minute roundtable about protein modulators. Many people are familiar with Trikafta. However, a similar modulator, Alyftrek, has also recently been approved. Many patients wonder what the differences between the two drugs are, if one is better than the other, and why you may choose to switch. Our roundtable portion of this talk will focus on the differences between these two modulators and why someone who either is or has been on Trikafta may want to attempt treatment with Alyftrek.
Our roundtable discussion on prenatal modulator use will allow for plenty of time for Q&A, so bring your questions. Our session will begin with a 20-minute presentation by a CF Pediatric Program Director, Dr. Sylvia Zenpetri. She will discuss key data and upcoming research on prenatal modulator treatment aimed at preventing CF complications after birth. Stephanie Marquardt, a mother of a CF child, will also discuss her firsthand personal experience with prenatal Trikafta use.
As we wrap up the opening session, I just want to say how truly special ResearchCon is. What makes this conference so impactful and important is that it brings every part of the CF community together. Researchers, clinicians, patients, family members, advocates, everybody gets a voice here. If you care about CF, this is the event for you. Your experiences matter, and your voice steers where we go next.
Yes, and just because you may be post-transplant or not in a traditional clinical trial doesn't mean research isn't relevant to you. Research continues to evolve and touch every aspect of life with CF, from mental health to transplant to aging. As a patient helping to plan this event, I've seen from every story and every perspective that they add value. This conference is about connection, collaboration, and making sure science reflects all of us.
And this is not a top-down conference. We are not here to talk at you. We're here learning with you. In every session, you'll hear from community members who are living this right alongside you. These conversations are meant to be interactive, so jump into the chat, ask your questions, share your thoughts. The more involved we all are, the more powerful this experience becomes. Thank you so much for being here with us. And let's get started.